Old age is a phase where the human body faces a series of natural changes, from the decline of internal organ functions to the gradual loss of flexibility in the musculoskeletal system. Among these, weak legs, most clearly manifested by difficulty walking, frequent falls, and reduced self-care ability, are increasingly becoming a major challenge for the health of older adults. This is not only a sign of aging, but also a warning sign of many other serious issues, from osteoarthritis and osteoporosis to muscle loss, sarcopenia, or prolonged malnutrition. Statistics from the World Health Organization, WHO, show that 1 in 3 people over 65 experiences at least one fall per year, and the leading causes are weak leg muscles or poor balance. Falls not only cause fractures, but also lead to dangerous complications such as bedriddeness, loss of mobility, and depression. For the elderly, just one hip fracture can become a serious turning point that completely undermines their health. Therefore, preventing weak legs early is a key factor in maintaining quality of life, independence, and overall health in old age. In addition to the causes of age and a sedentary lifestyle, a crucial factor often overlooked but profoundly affecting musculoskeletal health is diet. Many modern studies have proven that the deficiency of micronutrients, especially essential vitamins, can accelerate muscle weakening, cause osteoarthritis, and reduce the flexibility of the legs. Poor nutrition means that muscle tissues are not nourished properly, leading to muscle atrophy, reduced nerve reflexes, and imbalance in movement. Therefore, a proper diet is not only the foundation for maintaining overall physical condition, but also the key to protecting the flexibility and strength of the legs in older adults. Among the necessary nutrients, vitamins play a particularly important role. Unlike protein or calcium, which are often mentioned in literature on bone and joint health, vitamins are often underestimated or overlooked in daily diets. However, reality shows that vitamins not only support strong bones, but also promote protein synthesis, improve nerve function, enhance immunity, and protect muscle cells from damage caused by aging. These silent but essential roles are daily laying the foundation for a healthy and durable musculoskeletal system in older adults. Recognizing the importance of vitamins in preventing weak legs and increasing strength in the elderly, this article will explore 7 leading vitamins that the elderly cannot lack if they want to maintain the endurance and stability of their legs. 1. Vitamin D, the golden key for strong bones and mobility. Vitamin D plays a fundamental role in maintaining bone and muscle health in older adults. As people age, the ability to synthesize vitamin D through the skin under sunlight significantly declines, leading to widespread vitamin D deficiency. This vitamin helps the body absorb calcium and phosphorus effectively from the intestines, supporting the formation and maintenance of strong bone structure. Vitamin D deficiency makes bones porous and brittle, exacerbating osteoporosis, a major cause of weak legs and falls in the elderly. In addition to its effects on bones, vitamin D also supports the efficient functioning of the muscular system. It helps increase muscle strength, improve balance, and reduce the risk of falls, especially in frail older adults, who often have to sit or lie down for long periods. Many studies show that low levels of vitamin D in the blood are associated with a 1.5 to 2 times higher risk of falls. Moreover, vitamin D supports immune function and mental well-being, helping older adults feel healthier, more active, and less tired during daily leg and arm movements. Older adults should sunbathe for about 10 to 15 minutes in the morning, before 8 a.m., or late afternoon after 4 p.m. to stimulate natural vitamin D synthesis in the skin. In addition, they should eat foods rich in vitamin D, such as salmon, eggs, liver, milk, mushrooms, or fortified cereals. If there is a risk of deficiency, vitamin D3 supplements with a dose of about 800 to 1,000 international units per day can be used as directed by a doctor. 2. Vitamin B12, enhancing nerves and restoring sensation in the legs. Vitamin B12 is essential for protecting the central and peripheral nervous systems, especially the nerves that transmit signals to the arms and legs. In older adults, B12 deficiency is quite common due to poor absorption from food, due to reduced stomach acid, or due to the effects of medications, such as diabetes and stomach medications. When B12 is deficient, older people may experience symptoms such as numbness, tingling in the legs, loss of sensation when walking, muscle weakness, or even balance disorders. Prolonged deficiency can cause irreversible nerve damage, seriously affecting mobility and daily activities. Supplementing with vitamin B12 helps improve nerve conduction, restore sensation in the legs, reduce tremors, and support more stable walking. In addition, B12 is necessary for the production of red blood cells, helping to prevent anemia, a cause of fatigue, weak legs, and dizziness in older adults. Vitamin B12 should be supplemented from food sources such as beef liver, fish, eggs, milk, and cheese. For older adults who have difficulty absorbing it through the digestive tract due to age or medication use, B12 supplements in the form of sublingual tablets, high-dose oral tablets, or periodic B12 injections under medical supervision may be necessary to ensure effectiveness and safety. 3. Vitamin C, reducing inflammation, increasing collagen, and enhancing leg endurance. Vitamin C is a powerful antioxidant that plays an essential role in the formation of collagen, an important protein that makes up connective tissue in tendons, muscles, ligaments, and joints. With sufficient collagen, the leg joints move more flexibly, limiting friction and osteoarthritis, a common condition in older adults that causes pain, fatigue, and weak legs. In addition, vitamin C helps boost the immune system and fight chronic inflammation in the soft tissues around the knee and ankle joints areas that frequently bear the body's weight. In older adults with foot wounds, such as diabetic ulcers, scrapes from footwear, vitamin C helps them heal faster by promoting new tissue production and fighting infection. Vitamin C deficiency can weaken muscles, slow wound healing, and cause fatigue and loss of strength during movement. Older adults should eat a variety of fresh fruits such as oranges, guavas, kiwis, strawberries, and dark green vegetables such as spinach and broccoli. Vitamin C supplements in the form of effervescent tablets or tablets with a dose below 500 milligrams per day can be added. Avoid prolonged use of high doses as it can cause kidney stones or digestive disorders. 4. Vitamin E, antioxidant, enhancing circulation and reducing muscle fatigue. Vitamin E helps protect muscle cells and nerve tissue from the effects of free radicals, the cause of aging and tissue degeneration with age. As people age, the body's natural antioxidant capacity decreases, leading to muscle inflammation, leg fatigue, numbness in the limbs, and reduced motor strength. Supplementing with vitamin E helps limit tissue damage, reduce muscle fatigue, and protect the small blood vessels that nourish the leg muscles. Besides, vitamin E improves blood circulation, helping blood flow better to the lower extremities. As a result, older adults will feel warmer legs, less coldness or numbness at night, and reduced cramps due to poor blood circulation. Older adults with cardiovascular diseases, diabetes, and high blood pressure, who often have impaired circulation in the lower limbs, will benefit greatly from ensuring adequate vitamin E in their diet. Vitamin E is abundant in vegetable oils, sunflower oil, olive oil, almonds, soybeans, avocados, and green vegetables. If supplementation from functional foods is needed, low doses should be used and not exceed 400 IU per day, especially if taking blood-thinning medications. Consult a doctor to ensure safety. 5. Vitamin K, binding calcium to bones, reducing the risk of leg fractures. Vitamin K is necessary to activate proteins involved in bone mineralization, meaning it effectively transports calcium from the blood to the bones. Vitamin K deficiency causes calcium to deposit in the wrong places, in arteries instead of bones, leading to an increased risk of osteoporosis and atherosclerosis. In older adults, this is particularly dangerous because it both weakens bones and narrows blood vessels, affecting blood supply to the legs. Vitamin K also supports the natural blood clotting process, helping wounds on the legs, due to scratches, bumps, or chronic diseases like diabetes, heal quickly and not bleed excessively. When combined with vitamin D and calcium, vitamin K helps improve bone density, thereby reducing the risk of leg fractures from falls, a common complication in older adults. This combination helps the elderly's musculoskeletal system become more stable and firm. Supplement vitamin K through green vegetables such as spinach, kale, broccoli, or some fruits such as avocados and kiwis. People taking blood-thinning medications should avoid sudden changes in vitamin K intake. If supplementing with tablets, it should be done under a doctor's guidance to avoid drug interactions. 6. Vitamin B6. Stabilizing neuromuscular function, reducing tremors and cramps. Vitamin B6 participates in hundreds of metabolic reactions, especially in nerve transmission and protein metabolism, key factors that help muscles function smoothly. In older adults, vitamin B6 deficiency often causes feelings of muscle fatigue, unexplained muscle weakness, and even nighttime cramps or mild tremors in the legs. This vitamin also supports the production of serotonin and dopamine neurotransmitters that help improve mood, reduce anxiety, and enhance sleep quality. When combined with B12, vitamin B6 also contributes to protecting the peripheral nervous system, preventing problems with limb sensation or slow reflexes. As a result, older adults will maintain flexible reflexes when walking, avoiding many unfortunate accidents. Food sources rich in vitamin B6 include bananas, sweet potatoes, fish, chicken, and soybeans. The recommended daily dose is about 1.5 milligrams for older adults. Avoid high doses, over 50 milligrams per day, for a long time as it can cause numbness in the hands and feet due to nerve effects. 7. Vitamin A. Protecting tissues, healing injuries, and boosting leg resistance. Vitamin A is an essential nutrient for cell growth and regeneration, especially in the skin, mucous membranes, and muscle tissue. For older adults, vitamin A helps heal small wounds, scrapes, or foot ulcers that are common in people with poor circulation or diabetes. This is very important for preventing infections or serious complications in the legs. In addition, vitamin A helps maintain vision, an important factor for older adults to move safely, avoiding falls due to blurred vision, low light, or difficulty determining height differences. Healthy eyes combined with strong legs will help older adults feel confident when moving. Furthermore, vitamin A supports immunity, helping the body fight soft tissue infections in the legs, keeping the skin and heels from becoming dry and cracked, causing pain when walking. Vitamin A can be supplemented from carrots, pumpkins, sweet potatoes, animal liver, egg yolks, and milk. Beta-carotene from vegetables is safer than retinol from supplements. Older adults should only use vitamin A supplements when prescribed, as overdose can cause liver toxicity and impaired vision. To prevent weak legs in older adults, building a reasonable diet rich in vitamins is extremely important. The elderly should prioritize eating a variety of natural, fresh, minimally processed foods to ensure adequate supply of essential vitamins for bone, joint, and muscle health. Green vegetables, especially dark leafy greens like spinach, kale, and broccoli, should be included in daily meals as they contain many vitamins K, vitamin C, and antioxidants that help protect muscle tissue and increase limb strength. Fresh fruits, especially those rich in vitamins C and A, such as oranges, guavas, strawberries, carrots, pumpkins, and sweet potatoes, not only support immunity, but also help enhance collagen production, a necessary factor for maintaining the flexibility of muscles, ligaments, and leg joints. In addition, older adults should regularly eat fatty fish, such as salmon, mackerel, and sardines to supplement vitamin D and B12, two nutrients that help improve bone and muscle strength and the motor nervous system. Eggs, milk, and dairy products are important food sources of vitamins A, D, B12, and calcium, especially if fortified with vitamin D. During cooking, prioritize methods such as steaming, boiling, and quick stir-frying to retain the natural vitamin content in food, avoiding prolonged stewing or deep frying that can destroy nutrients. Furthermore, older adults should be encouraged to drink enough water each day, about 1.5 to 2 liters, to support vitamin absorption and keep the circulatory system functioning effectively, helping blood nourish the lower extremities well. In cases where older adults eat poorly, have poor digestion, or are at risk of vitamin deficiency, they can supplement with multivitamins or individual vitamin supplements under the advice and supervision of a doctor, avoiding self-medication with excessive doses as it can be harmful. A healthy diet rich in vitamins and maintained regularly each day not only helps prevent weak legs, but also improves overall health, helping older adults live more actively, independently, and happily in their later years. Weak legs in older adults are not only a sign of aging, but also reflect nutritional deficiencies, especially essential vitamins for bones, muscles, and nerves. Supplementing adequately with vitamins such as D, B12, C, E, K, B6, and A through a healthy diet, combined with a reasonable exercise routine, will help older adults maintain flexibility, strength, and independence in daily activities. More importantly, scientific nutritional care not only prevents weak legs, but also helps improve overall quality of life from physical to mental well-being. Consider vitamin supplementation as an essential part of the strategy to protect health in old age. And don't wait until the body sends warning signals to start paying attention. The strength of your legs is the foundation of an active old age, and that is entirely achievable if you start today.